Let's talk about some injuries that you might use rice for. One of the more common injuries that we see in clinic is called patellofemoral syndrome. What is patellofemoral syndrome?
So patellofemoral syndrome, or PFS, or sometimes just bilateral anterior knee pain, is usually an irritation of the cartilage underneath your kneecap. So what we're looking at here is a patellofemoral joint. There's a patella, here's your femur, here's your tibia. And basically it's an irritation of the cartilage underneath your kneecap, either from overuse or some activity that you're doing. And that's usually what PFS stands for.
Phil, some people talk about runner's knee. Is that runner's knee?
Not necessarily. So runner's knee, or jumper's knee, I'd say would be more of an inflammation of the patella tendon to the front of the knee, but the mechanism that can cause that discomfort can be the same for both PFS and patella inflammation.
Let's cut to a graphic. We want to see some of the symptoms that you might feel with patellofemoral syndrome.
So for sure with runner's knee or with PFS, you're going to have pain, activity with repeated bending of the knee. You're going to pain after sitting for long periods of time. And especially when you go to stand up, sometimes they call it there's an actual diagnostic test called moviegoer sign, where if you're sitting for long periods of time and you go to stand up, you have the discomfort to the front of the knee. Unfortunately, one of the main reasons is as we get older, that cartilage in the front of the knee is no longer as pliable, and it's not as soft. So as it gets more rigid, yet we continue to do the same activities we did when we were, let's say, 14, 15, 16. We like to sit with our knees behind us, kind of like how I'm doing right now. It causes irritation to that area.